Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight I want to talk about something that's very important, very, very dear, and very important to all dentists and all people, periodontal health. With me, I brought my very good, close colleague and friend, Dr. Richard Gilman. Richard, thanks for coming to Kansas City Alive with me. Periodontal disease is probably one of the most serious dental diseases that we have to deal with as dentists and that the public has to deal with, because millions of teeth are lost every year due to this disease, and so many times this disease is completely preventable. Again, Richard, welcome to Kansas City Alive. What are your views on periodontal disease, and what do you see as far as our viewers at home, what they can do to help prevent this disease?
Buford, I think practicing good dental habits is helpful in controlling periodontal disease, and good daily hygiene, building good daily hygiene habits, as well as seeing the dentist professionally on a regular basis and developing that habit.
Absolutely agreed. So many times we see patients that have gone years and years without professional dental care, and in many cases, especially with periodontal disease, and I want to contrast that as opposed to other dental problems. Periodontal disease is not necessarily a painful affair. It can be something that's relatively undetected by the patient until sometimes it becomes almost too late, or the consequences of the disease state become very, very severe. Again, I agree. I think probably one of the most important things is that patients come in, people come in and see their dentist every 6 months and have a very thorough and complete periodontal evaluation, an evaluation of their gums to make sure that their gums and the supporting tissues that support their teeth are in good condition. And I couldn't agree more with that. As a periodontist, what do you do most to help correct and deal with this problem?
Buford, I think we try and motivate patients to modify their behavior. We try and teach them gum line cleaning techniques, try and point out the areas where they're missing bacterial plaque, which is what causes the periodontal infection. And we take them through a course of therapy designed to remove the infection under the gum, which of course is what destroys the bone that holds the tooth in the jaw. A
chronic infection basically over many years in many cases.
True.
Richard, we have a phone call, and please go ahead. You're on the air.
Hello, yes. When I was small, I had third-degree burns all over my body, and my teeth were just coming in at that time. And I have very thin enamel, and I noticed that if I don't keep them properly cleaned, and I use the new fluoride wash and stuff on it, that I can really tell a difference. Did being burned at that time have an effect on the enamel as it was growing?
That is a very good question, Richard. What would you say?
It's possible that the enamel formation could produce a rough surface if it was defective.
Right. Assuming at what time that this injury occurred, did this happen at a very early age?
Yes, my teeth had just come out and the new ones were just coming in.
I see. We don't really have a good answer for that. Possibly yes, possibly no. I think probably what would be important to say is that despite environmental factors, it is possible to deal with periodontal conditions even despite many of the problems that occur or have occurred in the past. Would you say that's...
I know that the washes that they've come out with have just done super things, that I don't have to have all those treatments now. So I think they're helpful, yes.
We have some really wonderful, I guess you'd call medicaments, wouldn't you say, medicines. Chlorhexidine is one that's used a lot. The Viadent products are also good as well. all of them are very helpful for helping control periodontal disease. I think what's most important is that you continually evaluate your periodontal health by seeing your dentist and taking his advice.
Right. Thank you very much.
And thanks for calling. Richard, we brought with us a model here, and our people at home can see. What we have here is a very enlarged view of a molar tooth. You can see the bone all the way around the roots of the teeth. There's actually a little bit of tartar on here, compliments of the Procter & Gamble company, and a little bit of irritation around the gums. This is what we call gingivitis. Unfortunately, in time, this problem gets worse, and we'll go ahead and give it the flip side. What we see here is destruction of the bone, destruction of the gums, recession, and eventual looseness and mobility of the teeth. Richard, what can you tell us about the treatment modes that would be necessary to treat a condition of this magnitude?
Buford, we always try and use a non-surgical approach to treatment first in a modern periodontal practice. And initially we would try to remove the calculus or tartar from the root surfaces, often using a local anesthetic to prevent any discomfort, and in an effort to get the attachment between the gum and the tooth back intact.
Exactly. That attachment where the gums actually attach from little fibers that we call them Sharpie's fibers, but for the sake of lay terminology, little fibrous connections that go from the gums directly across, past the bone, directly into the tooth structure that forms a, what should we say, a gasket? I mean, that's a good way of putting it, a seal.
That would be a good way of putting it. I often use the analogy with patients of the attachment mechanism as being similar to the way that the skin attaches to your fingernail.
That is a good way of putting it.
The cuticle breaking down, so to speak.
I would also like to tell all of our viewers at home, this is a call-in segment, and if you would like to call us, if you have any questions about periodontal disease, gum disease as it's referred to, please give us a call. We'd love to hear from you. Richard, I know as a general practitioner, I do a lot of procedures involving treatment of gum disease. I refer to it as scaling and root planing, periodontal scaling. I think I spend close to 90% of my time treating periodontal disease, and probably rightfully so, because it is one of the main reasons people lose teeth. And I can't emphasize enough how important it is for people to engage in a day-in, day-out maintenance program. Call it a military maintenance program. That means every day, without fail, you must floss, you must brush very thoroughly. What can you tell our viewers at home about brushing and the importance of being thorough?
Well, there's often a time illusion when we clean our mouths, and it takes 3, 4, 5 minutes to do a thorough job. Often 30 seconds is what the stop clock measures, unfortunately.
Right.
So I think people might try and use an egg timer and see how much time they're actually putting in. Also, the toothbrush, as you know, will not reach between the teeth, so dental floss is critically important.
Exactly.
Cleaning the gum line can sometimes be aided by the use of a toothpick.
That's good. There's also other devices, I think they call them proxy brushes, that are also helpful for some people. We have another phone caller, and you're on the air. Please go ahead.
Hello?
Do we have a phone caller?
Am I on air?
Yes, you are. Please go ahead.
Okay. I'd like to ask Tim, I have, they said that I had maybe like the starting of gingivitis, I think, and I was wanting to ask him, what is it although this has already started and my tooth is loosening, and I'd like to know, is it possible that it can be, at this particular point right here, could it still be got back intact, or something can be done, or, is it like a continuing type of thing, it just gets worse, or what could be done?
It's difficult.
Good question.
It is a good question. I think I'll refer it to you. No, I'm just
No,
kidding.
go ahead, please.
It's difficult to make a diagnosis over the telephone, so I really need to speak in general terms. But often, loose teeth and inflamed gums can be reversed, and the tooth, with some proper periodontal treatment, can return to a healthy state and become tight and comfortable.
Doctor, wouldn't you say for our viewer that called in, probably most importantly that you be evaluated on a continual basis to prevent this problem from getting worse, because that is so very, very important that you be evaluated and have this initial treatment instigated to prevent this situation from getting worse, because the early stages of periodontal disease, or gingivitis as it's referred to,
is that the same periodontal, that's the same as gingivitis?
Well, gingivitis is the very beginning of periodontal disease.
Okay.
It's the very first stage, and in many cases it's very treatable if you seek professional help and if you follow very stringently the advice of the dentist giving you professional help. There's a very good chance that the situation can be dealt with, but under some circumstances it's important that you see a periodontist, a specialist like Dr. Gilman here, for more involved and in-depth treatment that goes beyond that which myself as a private practitioner would be able to provide. Did that answer your question?
Okay, so like I think it does. So in other words, just see my dentist and see what they would more or less say. I mean, if I needed to see someone like him, they would refer me. Is that correct? Or?
Absolutely.
Okay. Well, thank you very much, gentlemen.
Thanks for calling.
You.
Well, that brings us to other points. We see a lot of periodontal patients. You see periodontal patients exclusively. I see periodontal patients 90% of the time. I think I'd like to point out scaling and root planing. We like to be very conservative about treatment. I do not personally provide periodontal surgeries. I made this choice myself as a general practitioner because I felt, because of all of the things that I have to do as a dentist, that there's just too much for me to do in diagnosis to get involved with the intricacies of periodontal surgery. So I do a lot of the, how should we say, the interim or beginning therapy, scaling and root planing, use of a local anesthesia to anesthetize the gums, complete removal of tartar or calculus as we call it, and keeping or at least getting the tooth surfaces in a cleansable condition. But that leads us to the next point. We go from that point to the next point, the referral to you. The possible and potential surgeries. What criteria do you use for deciding whether a patient needs to have further treatment, periodontal surgeries, and what's involved with that?
That's a good question, Buford. Patients who continue to have periodontal pockets or pyorrhea following the initial deep cleaning or scaling and root planing phase are candidates for minor gum surgery, or flap therapy as we call it.
Now that's where the gums are actually cut into and reflected back away from the teeth and the bone.
Right. We used to do a procedure called a gingivectomy, which is no longer used commonly, where the pocket of gum tissue was pared away. Today we try and retain all of the tissue and lift it away from the root so that we can see more efficiently and so that we have better physical access to clean the root. And then the gum is retained to as great an extent as possible and sutured back, often in its original position.
Okay, that's quite a procedure, and as I understand, it's a very complicated and very precise procedure. We have 1 minute left to go. Is there anybody out there that would love to give us a call? Let's talk to you for just a moment. Shed our experience as practitioners of dentistry. We'd sure love to hear from you. And again, Richard, I really do appreciate you coming down here. Again, I think the most important thing is, going back to our model, this is the net result of what happens if we don't treat periodontal disease. We don't want this. What we really do want is this, and an improvement upon this, where we have strong teeth embedded in strong bone with a good, strong, healthy gum tissue around it so that we can function and be in good shape. Richard, I really appreciate you coming on Kansas City Alive with us. And again, thank you for watching Kansas City Alive. This is Dr. Casebolt with Dentistry and you.
Stay tuned. When we come back, you'll find out what's on Wednesday's Kansas City Alive.
It's time for You Lost Your Life with your hosts, Christ Cummings, Vince, and Larry. Hi!
Hello! And welcome to the show that proves if you don't buckle your safety belt, the loser is you.
That's right, Vince, and by not buckling up, you could end up in places you never dreamed.
Like traction!
Or the emergency room!
Plus, Larry, if you're not buckled up, you could maybe take a ride in a beauty like this. Stay tuned!
You could learn a lot from a dummy. Buckle your safety belt.